Okay, good afternoon, everyone. It is now noon, so we're going to go ahead and get started. I am Helen Hockey, Executive Director for the Pennsylvania Coalition for Oral Health, and we are so glad that you have joined us today. This is our 6th year of offering virtual meetings, and we have found, especially during the COVID pandemic, that being able to give an update to all of our stakeholders virtually has come in handy. So we're happy to offer these brief updates on the coalition work. We do them twice a year, once in the summer and once in December. And as always, this meeting will be recorded and shared on our YouTube channel. So you're able to share the link with others after today, if you wish, or to come back and revisit a section of the recording if you need to refer to it. So some housekeeping as we get started. This format is set up as a webinar, so all lines have been muted by us, which will keep the background noise to a minimum. You may type any questions that you have into the Q&A box, which should be in a bar at the bottom of your screen at any time during the presentation. We may be able to grab them as they come in, but if not, we'll answer them during a few minutes at the end that we'll have for Q&A. For those that are joining by phone and who are unable to see the slides right now, I do encourage you to go back and review the video at a later time. We'll make sure we send the link out for the presentation directly to everyone who participates today. And the slides will be sent by themselves as a PDF so that for any active links that are embedded into the slides, you'll be able to click on those and visit those resources as well. So with that, we'll go ahead and get started. So I'm going to take just a minute to talk to you guys all a little bit about what PCOH is and what we do. Many states have developed oral health coalitions over the last 20 years. Some of them are even older than that. The role of oral health coalitions is not really centered on a certain type of health provider or a specific policy goal, but more of a broad spectrum collection of groups, individuals, organizations who are really passionate about oral health, and we help them share ideas and work together. So we play a role in initiating new projects and programs from time to time, but a lot of our work really comes from connecting people. Pennsylvania is also proud to be part of the American Network of Oral Health Coalitions, which is a national network of similar groups. So we're able to meet with other state coalitions and share ideas. Our coalition was incorporated in 2016 with the addition of staff and a more formal board structure. We're a registered nonprofit with the state of Pennsylvania, and we rely mostly on grants and donations to complete the bulk of our work. So with every staff person and every stakeholder we add, their unique backgrounds kind of help us contribute to the reach and knowledge that we have. And we're very, very grateful for each and every person that decides to join with us. The connections that we're able to make around the state mean that nobody has to recreate the wheel. We're always willing to share materials that we have or knowledge, and we're able to learn from each other. So we really appreciate it when others take the time to share their knowledge with us. So to start us off this afternoon, I'm going to invite our board chairperson, Dr. Deborah Polk, to say a few words of welcome to everyone. So good afternoon, Dr. Polk.
Hello and welcome to everyone. On behalf of the board, I want to welcome you to our virtual stakeholder update today. And I am really, really glad that you can be here to hear what we've been doing and get ideas and connect with us because what we do depends on you. So thank you. And I really hope that you are able to get involved in 2022. Thank you. Back to you, Helen.
All right, thank you. For those who didn't know this, this PCOH event actually marks our last official one with Dr. Polk at the helm of the organization. She has really given so many years of amazing service, and I personally couldn't be more grateful to have her as a partner and mentor in the work that we do. But don't be alarmed, because even though she will not be the board chair next year, we're not going to let her get away. And she's going to be remaining on our board as our immediate past chair. So we'll get to keep her around a little bit longer. And we're also really, really excited that we will have Miss Lisa Davis from the Pennsylvania Office of Rural Health to begin her role as board chair in 2022. So our team's been working together for a few years now, so I think we'll have a pretty seamless transition in board leadership. So we are going to proceed with the remainder of our presentation today. For those that have been participating with PCOH for a while, our first few slides, of course, will be a little bit familiar, but we've got some new folks on the call, so I want to give a little bit of background on the coalition itself. So here are, of course, our amazing staff. When you attend a PCOH event or you reach out to us about a specific issue or concern, these are typically the folks that you're going to be talking to. Mary Lynn handles the bulk of our fluoride and dental sealant work, as well as taking care of development and fundraising. Angela is our newest staff member who coordinates our nicotine and tobacco work and has been doing a lot around dental workforce. So we're really starting to pursue some of the pieces of dental workforce and how we can influence that in the state. And then Amy, of course, does all of our communication and event planning, as well as about 100 other things, social media, and basically everything that keeps us straight and moving in the right direction. So all of our individual emails are hyperlinked right into the slides. So when you have those, you'll be able to reach out and contact us anytime. And I should also mention that PCOH relies on a number of students each year to help us support our work. So if ever you know of students looking for internships or school projects in public health, always please feel free to connect us. So that's something that we rely on our stakeholders for resources around. And so for those of you who've been around a while, our priorities should look very familiar to you. Of course, I mentioned workforce is a top priority for us, and that includes, dental and non-dental folks that become part of the oral health workforce. We like to build in oral health policy into other systems and all systems. So we're going to talk a lot about that today when we talk about the work we've done in 2021. Our priority down on the lower left there, improving oral health for Pennsylvania's most vulnerable populations, is one that we really sort of blend into all of the work we do. So oftentimes things that make folks more vulnerable sort of overlap with other work. So when we try to really focus on those populations, and that can include people with disabilities, that can include low-income families, racial and ethnic minority, is just a number of folks, sometimes geographic area. So we look at rural health as a big part of our focus. And then the last topic there that you'll see for our priorities, of course, is advocating for community water fluoridation. And that's something that has been the focus of the coalition for over a decade. Even before we were really formalized, we were worrying about community water fluoridation. And we've made a lot of progress, which we'll talk a little bit about today. So lastly, before we get into the work that we're doing this year, of course, I want to recognize how fortunate we are to have a lot of support from many corporate and community funders. We are a 501c3 nonprofit, so we're really happy to report that 86% of all of our funds raised in 2020 went directly to programs and program administration. So, that's either through programs that we host directly or that we work with through partners and subcontractors. Many of our programs use federal and community grants, but we also rely really heavily on our corporate, organizational, and individual funders to keep us moving. And many of our funders have been providing annual support for a lot of years, and we just really couldn't do it without them. You see some big names on the slide here, but it also includes a lot of the individuals who give, even small amounts every single year during our appeals. We publish an annual report after the first of the year, and we would encourage everyone to visit the website where you can actually see the annual reports, learn about who supports us, and you can even click directly on some of our corporate sponsors and learn more about them. So on behalf of the board and the staff, we really just thank everyone who's contributed to our work. It's been overwhelming what we have seen come through during this pandemic and the support that we've gotten. And so, you know, we just kind of always want to keep that growing. And so if you haven't had the opportunity to donate to PCOH, or you know of an organization that might be interested, we're always happy to discuss that. We always run 1 or 2 appeals a year, which give all of our stakeholders the opportunity to be an official donor to PCOH. And many of you have probably received an email or a mailed letter with this information in the last 2 weeks, along with a magnet that we're sharing with donors and stakeholders this year. So please let us know if you haven't received this information, and we'll make sure that we share. And so I mentioned this a little bit before. I'm not sure if anyone caught it, but we, you know, even though we've been around as an organization for over a decade, we did not become formally incorporated until 2016. So that means we just celebrated our 5-year anniversary of being official. And looking back on the last few years, it's been amazing. You know, I've been with the org for 4 years, and I can tell you that it's just been so wonderful to watch the organization grow and evolve and change with the times and the needs of the communities. So I really cannot wait to see what we're going to do over the next 5 years, because I feel like we're really poised to make a difference. So wonderful, wonderful stuff. Today, we're just going to focus on 2021. Our end of the year webinar has always historically been a great time to let you know what we've been working on and the progress we've made. So, and I'll also point out, again, all of our PCOH staff and board members are here for your questions and concerns. So if you hear about something today that you want more information on, or you really want to get involved in it, please do reach out. Our quick 45-minute slideshow today is never going to encompass all of the details of the work we do. So we love to talk more about it individually with stakeholders. So if you want to set up a meeting or a phone call and learn a little more about a specific project, we love talking about it. So, all right, so let's dig in for today. Just wanted to start with a brief overview of our work groups. These are groups that we're actively working in 2021. So we maintain a community water fluoridation task force that is sort of poised to go out into communities as needed for when we have threats to water fluoridation. We have a Medicaid adult dental benefits task force, which focuses really on increasing access to adults who are served by Medicaid. Our Family Oral Health Collective Task Force is probably our oldest one, we could say maybe. That is a group of organizations from around the state that focuses not just on children's oral health, but how that relates multi-generationally to families as a whole. So we're going to talk a little bit about some of the work we've done with them this year a little later. Our Oral Health Workforce Task Force is the newest official work group that we've developed. And we're going to be launching a more widespread event for that later in 2022 to sort of get more folks to the table talking about the oral health workforce. So stay tuned on that. And then lastly, our School Salem Program Task Force is a wonderful group of municipal and county health departments, federally qualified health centers, and school districts that are really, amongst others, that are really focused on improving access to dental sealants in schools. So again, some really great groups, and we really rely heavily on our volunteer stakeholders to sort of help manage all the work that goes along with those. So we're going to start a little bit with workforce, as that tends to be sort of the thing that's been most top of mind for everyone right now. So we can't talk about workforce unless we first talk a little bit about dental health HPSAs. So the dental health professional shortage areas around the state, those are determined through the Health Resources and Services Administration, which most people know as HRSA. And they basically base them on if there's less than a 1 to 5,000 ratio of dentists to population. Okay, so 1 dentist per 5,000 people in an area. Now, it can be in a geographic area, it can be in a facility. There are a variety of ways that you can qualify as a dental HPSA. And so we've seen some improvement over the last few years, but our most recent report, which was based on September 30th numbers, actually we saw a little bit of an increase in the number of dentists needed to meet the need. So they break our state down. All of the purple on the screen that you see are, areas where there is a shortage of dental health providers. So we have 157 of them right now, and HRSA predicts that if we could specifically put a dentist in each of those purple areas, we would need 305 dentists to meet the need. And that is a little bit up. We were in the high 200s in June, so that's gone up just a tad. And one program that's worked in the past for this is loan repayment or forgiveness models to entice dentists and hygienists to practice in those dental health professional shortage areas. Annually, our state determines a budget for that amount. And in Pennsylvania, that funding is distributed as 50% to primary care providers, 25% to dental providers, and 25% to mental health providers. So, there's actually a formula for it and how we determine those things, but each type of care is ranked separately. So for dental providers, their 25% of that total state budget is allocated to the top scoring dental providers downward until all the funds are depleted. Okay, so depending on how many applications they get, that's how we determine those. So for 2019, which is the last year we have formal numbers for, there were 205 total applications to the loan repayment system, and 41 of those were from dental providers. So that's a decent chunk, and it runs right around the average that we've seen. It's typically 17, 18, 19% of the total applications. So in 2019, there were 14 awards to dental providers. The average usually runs around 9, but we had a lot more dental hygienists apply in 2019, and their maximum award is $60,000 versus a dentist maximum award, which is $100,000. So when we award money to only dentist applicants, then the money doesn't go as far. So when we add some hygienists into the mix, we're able to award more folks. And then as of last summer, who is currently working in our state under the loan repayment program, we've got 25 dental providers participating, 18 dentists and 7 hygienists. So, as you can see, the actual funding and availability of these positions really isn't enough to make a dent in the need. So I mentioned we need 305 dentists to meet the need, and we've got 18 dentists right now actively in the loan repayment program. So definitely some need there, and we recognize that. So we're also really concerned that COVID's had an impact on auxiliary staff working in the dental offices. So just like in other industries right now, we've seen a major drop in available workers. So PCOH is getting a lot of inquiries to ask for ideas to recruit and retain dental staff. Some of our federally qualified health centers are now setting up their own dental assistant training programs to entice more young adults to enter the profession. So what are we doing about this? We are, one way that we've worked recently on improving this issue is to strengthen our existing workforce, making sure that the folks that are out there can do as much as possible. So over the last few years, we've had almost 2,000 dental providers take continuing education courses with us and our partners. And then in the last year or so, we've added courses on training dental providers to offer nicotine and tobacco cessation counseling. Medical assistants will now pay for that service once all of the training is documented. So in 2021, we've been trying to streamline that program with the state to make sure that providers are getting prompt and accurate reimbursement. So working with the Department of Health and Department of Human Services. And we're going to be updating our website in the next month or so with more information on making sure you're joining the Department of Health and Department of Human Services registries as a nicotine and tobacco cessation provider. So we're also focusing on getting more providers to see patients with disabilities. We've got about 5 hours of free CE available on the subject on our website, and we've developed numerous materials for providers to use. So this year we've done a deeper dive into some possible solutions for increasing dental provider interest in this population. Something that we've noticed is that Many dental providers want to see patients with disabilities, but they maybe don't feel quite comfortable doing that. So we're trying to increase that education. So that's been one of our focus areas. And then we've got to talk a little bit about just the straight number of dentists in our state. So many of you were able to join us this summer when we hosted a webinar with the ADA's Health Policy Institute. And, we announced our completed reports and our results on the dentist workforce and where it's going for PA. So that full report is on our website. If you haven't seen it, definitely check it out. It has lots of data and information, but I'm going to give you a quick 1-minute summary here today. So when we look at the numbers closely, the supply of dentists in Pennsylvania is really expected to decrease through 2030. And this is on a per capita basis. So this is not, some areas need more than others. This is per person population ratios here, okay? So, when we're talking about these numbers that you see on the screen, the 60s and 50s, that's how many dentists per 100,000 people. Okay, so we expect to see this decrease through 2030 and then stabilize through 2040. So the next 10 years or so, we're not predicting a good increase in dental providers, which is a little bit scary. The other thing we know is that the female share of the workforce is projected to increase from about 1/3 in 2020 to just over half in 2040. Which is a pretty significant thing, I think, that we're going to start seeing a lot more female dentists entering the workforce. And so we do expect that we're going to gain slightly more dentists than we lose, but it's not going to be enough to keep up with the growing population. So that's definitely a concern for us. And then specifically, the number of dentists in our state is much higher in urban counties per capita. In addition to the counties not designated as shortage areas, compared to our rural areas. And so, we actually have, our urban areas have just about double the amount of dentists per person as rural areas have, which is a pretty significant gap. And then, of course, the aging workforce continues to be a concern, particularly in those underserved areas. Our dentists that are 55 and older make up the majority of our dentist workforce in rural counties. And so in the coming years, those counties could lose dentists at a much more rapid rate as retirements increase and new dentists might be less willing to locate there. We're seeing a downward trend in things like solo practices or private practices. We're starting to see a lot more corporate and group practices opening up, but in rural areas, that's much less likely to happen. So we're expecting the gap in rural to probably get a little bit worse before it gets better. And then along with the look at the inflows and the outflows of the dentists, the Health Policy Institute was able to conduct a survey specifically for Medicaid members in PA. And we had over 600 responses in the early part of 2021, which we thought was a really great response rate. And the majority of the enrollees in Pennsylvania did say that they were aware of dental benefits under the program for both adults and children. So as you can see, we had the adults knew that there were benefits for adults. It was about 80%, and then a slightly higher amount, 87% for them knowing that children's benefits were available. I do still think it's a little crazy that 1 in 5 of the adults don't know that they have dental benefits. So I think that we definitely have some work to do in educating the general public, particularly those served by Medicaid. When we look at the second chart there and we look at, how long it's been since folks have used their dental benefits and gone to the dentist, those numbers get a little scarier for adults. As you can see, only 39% of adults have had a visit in the last year. So we know that there's a higher need for that. And some of that could be COVID related, because again, this was done, back in the spring of 21. So it would have been right around the 1-year anniversary of the shutdowns. But there still are so many folks, if you look there and you look at that orange bar on the adult side, that haven't had that their visit was more than 2 years ago. So that means they weren't getting regular care even prior to COVID. So we definitely have some work to do around there. We do much better with our kids, but the adults, we've got to do some better work. And we did ask, what's the barrier to getting dental care? And the number one thing, specifically for adults, was that they couldn't afford dental care that wasn't covered by their insurance. So even though they have some benefits through Medicaid, they weren't able to get the work done that they needed to get done. And we still see the, listed as a reason, the inability to find a dentist who accepts Medicaid as well. And that's a barrier for adults and children. So definitely stuff we need to look at. So now that we know that the number of dentists is expected to decline over the next few years, we've got to focus on some solutions to that problem. We continued our work of talking with students in dental schools and dental hygiene programs about dental public health and dental needs in our state. We've been using a book study protocol and Mariotto's book Teeth for the last few years. And just in 2021, we were able to meet with 212 students. We are surveying those students both before and after their experience with the book. And we're happy to report that we've seen an increase in the percentage of students who are considering working in public health. So that work is part of a 4-year HRSA workforce grant with the Pennsylvania Department of Health. And we're going to have some final evaluation results after that 4-year grant ends in August of next year. So another part of this work is that we focus on potential dentists, hygienists, and assistants in the high school populations. So, focusing on career pathway programs. We've been working with the area health education centers and some other organizations to promote dental as a career option. We did 8 career pathway programs this year and reached over 450 students, which we were really pleased with. So we've got survey comments from these programs that have been interesting, and they show that simply talking more about dentistry as a career can pique interest in these students. So some of them admitted to not even thinking about dental school or dental programs, but changing their minds after they hear all of the options that are available in the dental industry. So I just encourage those of you who have access to these potential dental employees to make sure we're talking about it. We all can play a part in trying to get more folks interested in dental careers. Another shining star, we had conferences beginning again this year, and a number of water conferences, which are always a big part of our work. We love going and talking to water operators and water systems and talking about community water fluoridation. So this year we were able to talk to over 900 individuals at 4 different conferences. And one of the things that we were most proud of is that we had an opportunity to formally present some Fluoride Awards that are, sort of sponsored by the CDC, ADA, and the Association of State and Territorial Dental Directors. And we were able to give these water systems awards in recognition of their public health service. So for those of you who may not be aware, just in the last month, Pennsylvania finally finalized the appointment of Dr. Denise Johnson, who's pictured here in the center of the picture on the left, as our state physician general. So she was in an acting position, and now she has been appointed as the state physician general. Dr. Johnson, really is amazing because she served as a community leader back in 2015 through 2018 in her hometown of Meadville to get their community water system to begin fluoridating. So we're really thrilled to have her in a state leadership position and as a fellow community water fluoridation advocate. So she was able to present some awards to those water systems this year, which was just a really great opportunity. And then each year we look at our what we call rollbacks in communities as well. So fluoridation rollback is what we call it when a community that has been fluoridating discusses stopping that practice. So public notices are required. PCOH uses our task force to work with the local communities and prevent the rollback. I actually had to update my slides today because we got some great information just in the last few hours, but we had 3 rollback threats this year, dispatched our task force, offered resources and services to assist the community. And we had 2 of those 3 had a positive outcome, and those communities chose to keep fluoridating. So we're really, really happy about that, and we continue to work in that area. And then, of course, continue our relationship. We work with Pennsylvania Department of Environmental Protection. We try to focus on learning more about the fluoridation process in Pennsylvania and share that out with our stakeholders and work with water operators through them as well. We do hope to hold some local water meetings in 2022 and probably do an advocacy training next summer. So we do try to do every other year or so an advocacy training for either oral health professionals or other professional community advocates that want to learn more about community water fluoridation and talk about it. So stay tuned for next summer, where we'll hopefully have that training information out soon. So data tracking and surveillance remains a really important part of the fluoride work. So this is, the most recent data that we have. We credit this, of course, to Mary Lynn here at PCOH. As I told you guys, she does a lot of our fluoride work. And she's really an expert at understanding the infrastructure of these community water systems. And so we're showing you some critical statistics today. So when we talk about individuals who receive optimally fluoridated water, we look at two populations. So the first is the total population of the state. For us, it's around 13 million people. And we only look at the areas, who in the first data point, we only look at those areas who get their water from a public water system. So that statistic, that 55%, will exclude households that are served by private wells. Okay, so in 2020, we were estimating 55% of people who get water from a public water system are getting the benefit of fluoride adjusted water. The second statistic, so that's the 49%, looks at the total population of the state when coming up with a percentage who are getting fluoridated water. So that includes everyone, including the 1.5 million individuals on private wells. And I do want to point out that Pennsylvania does have naturally occurring fluoride in most of the well water across the state, but it's most often under 0.3 parts per million. So that's only about half of what we need to have healthier teeth. So our individuals on private wells are getting a little bit of fluoride, but not enough. So that 2020 estimate for the entire state population, that 49%, is taking into account wells and public water. And that's a pretty far cry. So when we look at what our national goals are, the 2030 healthy people objectives, the US goal is 77.1% by 2030. So we have a far way to go with that. Now, there's different ways of calculating these numbers, and regardless of how they're calculated, we're really in the bottom. We're in the bottom of 10 of the 50 states when you rank us in population receiving fluoridated water. We look around at our neighbors, Maryland is a great example. Over 93% of their population is served by public water systems getting fluoridated water. So we've got a really long way to go. And one of the things that we get is a question, and many of you know about our mapping project that we recently completed. So there's a link at the top of this slide that you'll be able to click on. If you haven't checked out our fluoride map, we were able to update a map with the most recent data available to see if your own community has fluoridated water or not. So that's a great map to use, especially if you're working in healthcare and you're working with certain populations and you need to know if they're having access to fluoridated water. Please definitely check out our map. It is routinely updated with any changes to the systems. And if you see a change that's needed on the map, then you can let us know and we can update it. So a really great resource that we have finalized last year, but we've really been rolling out a lot more this year. Another project that we've been working on, I'll just spend a couple seconds on this, is we are trying to collect stories from all 67 counties where people have struggled to access dental care. We want to make sure that we're able to use specific stories from specific people in the advocacy that we do with decision makers, the legislature, the governor's administration, all of those folks. So really, really important. And we just invite everyone to share this link at the bottom here with your colleagues so that we can get, we want to fill up our story bank with stories from all 67 counties. Okay, so that's an ongoing project that's going to roll into 2022. So a few more statistics on our work. We're going to discuss that first one with the next slide, but I'm going to focus on the middle and last statistic here for a moment. That middle statistic shows the number of health professionals that have taken free CE courses on our website just in 2021. So that's 363 of you, which is really great. And we're hoping to add another course or two in the next year. So possibly something around HPV. We definitely hear that HPV is a subject that we need some help with in that public health dental space. And then, the majority, that last statistic, you can see the majority of our course interest this year was really centered around our tobacco and nicotine course. So dental providers are fortunate to have some unique relationships with their patients, and often they can see patients more than their medical counterparts do. So it's that twice a year cleaning thing. And then if you're having a lot of restorative work done, you might be in the dental offices 5 or 10 times in a year. So it presents a real unique opportunity for dental providers to talk about nicotine cessation. So PCOH is really happy to provide background and education for those providers to feel more comfortable. The course is available for free on our website. And then along with that, we also want to help dental orgs, dental providers, partner with regional tobacco coalitions. So every area in our state has a regional tobacco coalition that will help you get resources, provide help for your patients, sometimes printed materials. And so we're happy to connect anybody with that regional group as well. So really, really important. Then we're going to go back to that first stat. So a new project this year was, this is our request materials page. And it just launched at the end of the summer. So we tend to share a lot of resources and we create a lot of educational flyers. But we had a lot of requests from organizations who either couldn't afford to print copies or they wanted PDF links to include on their websites or in their newsletters. So we decided it would just be easiest to add a page to our site to really serve as a clearinghouse for our most popular documents. So now folks can sign in, they can get request materials in small quantities that would already be printed in good quality color printing and shipped directly to them. So far, since the launch a few months ago, we've actually had individuals request more than 2,300 pages of our materials. So if you haven't looked at this page on our site yet, be sure to check it out. We do ask that, if you're requesting a lot of materials, if you're able to donate just to offset some of our printing and shipping costs, we really appreciate that. And if not, we seek other grant funds to help cover those costs. So you'll see that on our website. And so here's 2 of the documents that you can find on that page. These were educational flyers that we worked to develop and publish this year. We worked together with the PA chapter of the American Academy of Pediatrics and the Pennsylvania Office of Rural Health staff on these. And we're really proud of them. The corkboard flyer on the left there was designed with a middle school, high school audience in mind. So we really wanted kids to think about not just, hey, there's sugar in your drinks, but we also wanted them to feel confident that they have the autonomy to choose what they should drink and what they put into their bodies. So, really turning it back to them to say, you're making this decision, you're deciding how much sugar you're taking in. And of course, water is always the choice that we want to see them make. And then the flyer on the right on beverages was much more focused on the population of parents and caregivers of young children and the pregnant population. So wanted to, clarify those sort of old thoughts that, kids should start drinking juice out of a bottle at 6 months old, right? We've got to fix that line of thinking, and really encouraging that consumption of water and how important it is to get that started at a very early age. So we've had a lot of requests for these materials, and they're all available on that request materials page that I just mentioned. So check them out. Another project we became involved with this year. So it's a really great example of how we partner with organizations who are working on other initiatives and encourage them to include oral health as part of their planning. So I mentioned about integrating oral health into the systems as one of our priorities, and this is a great example of that. So the YMCA Center for Healthy Living in Harrisburg was working with Penny, the Pennsylvania Insurance Exchange, and decided to hold a year-long tour of YMCAs in every county of the state. And they're offering resources like blood pressure screening, insurance coverage assistance, anything that's possibly related to living a healthy life. And they're holding these one-day events in the communities. So working with our Family Oral Health Collective work group, we were able to provide materials and activities and educational tools so that oral health is actually included at every single one of these events. And you can see the pictures there. These are not our staff. These are not our volunteers. These are YMCA staff that have actually, received these resources and been trained to talk about things. And here they are now using these oral health resources directly in these communities. So it makes us really excited. And the project just started in May. So as you can see, they've already completed 46 stops around the state and distributed materials to over 5,000 people. And it really didn't take too much of our time and effort. We're able to rely on others that are doing great work and just implementing that oral health alongside it. So really, really excited about that. One of my favorite projects we're working on this year, something I get really excited about, is when we start talking about dental public health, we talk about surveillance. And, we often conduct research on individuals and groups to learn about the impact of interventions, but surveillance is a little bit different. So public health surveillance, if you're not familiar, is defined by the World Health Organization, and this is a very nice long description, but a continuous, systematic collection, analysis, and interpretation of health-related data. Okay, so that's what surveillance is. So it helps us, it serves as a warning system for problems that could become a public health emergency. It helps us monitor and evaluate the impact of interventions. So in a community, helps track progress towards a specific goal. And then also can help monitor and clarify the epidemiology of health problems. Okay, so we can set our priorities and do our goal evaluation properly. So to this end, we're working with the Pennsylvania Department of Health to conduct our first ever basic screening survey, which is widely recognized by all the states as sort of a gold standard for children's dental health surveillance. So it involves screening thousands of children across the state for very basic data using fully calibrated screeners that are all using the exact same standard. So a certain percentage of the population is selected based on a number of characteristics like race and ethnicity, income demographics, geographic area, much more. And then we use a representative sample of that population. So we can use those data to predict what the entire population is facing. And so just a quick update on where we're at with that now. We're implementing it right now in this current academic year. We were 74 of 80 schools confirmed. 21 of our 80 screenings are already completed. So we've got data rolling in. Originally, we were looking at more than 8,000 students, but just with changes in enrollment in some of the schools, right now we're looking at screening over 6,000 children by the end of the school year. And the data that's actually collected is on cavity experience, dental sealants, and the urgency of dental referral. So those are the factors we're catching. So stay tuned. We should have some preliminary results available next summer. So my favorite quote, without data, you're just another person with an opinion. We've got to have data. And we always talk a little bit about the Pennsylvania Oral Health Plan, which runs from now through 2030. And our Department of Health Oral Health Program really, has set up a surveillance system where we're looking at different numbers and data sets all the time now, which is really great. And we're starting to get some data that are available. So I'm going to show you guys some of the things that we're working on with the plan. And I'm not going to read all of these to you, but you can check them out. One way that we measure the progress of our data that's within our oral health plan, is to see where we are at the same point, on the same point of data over time. And so all of these numbers that are on the left side are really the numbers where we were at either in 2018, 2019, or 2020, depending on when the baseline data are available. And then our 10-year goal is what's after the little caret there. So those are our 10-year goals for what we want to accomplish in the state. And so under access as a priority in the oral health plan, there's actually 13 of them. This is just the first half. And I'll encourage you guys to check the slides out to really dive into these more deeper. We're going to move a little bit quicker. But the next remaining 6, you can see under the access, are listed here as well. So we have 13 different data points that we're going to be checking out on an annual basis to make sure that we're making progress towards our 10-year goals. So really, really exciting. Happy to talk about any of these in more depth with anyone, because it's a little complicated, but we're happy to tell you guys where the data come from and why we chose the goals we did. We try to stay in alignment with CDC guidelines and with what seems reasonable based on prior progress. So, and then the second priority in our oral health plan is workforce. So we also have some goals there that kind of go back to some of those earlier slides. So getting more folks in the Medicaid program, more dental providers, seeing and billing to the Medicaid program, and then getting those dental health professional shortage areas to adjust in a positive way, making sure we integrate dental care into medical sides of things. And then lastly, looking at our community health workers. So how do we make those connections for folks in the community so that they know about dental care and why it's so important? So really some amazing stuff we have going on there. Stay tuned because we'll be putting out some regular reports on our progress there. So I think one of the last things I wanted to talk about today was just really to thank everyone who was you guys were all, I know half of the folks on the call were such a big part of the work we did in holding our first large convening in a very long time. We had our statewide oral health summit just a few weeks ago. And so we've started to get some great feedback from the event. We're going to have all of our pictures and notes and information coming out on our website soon. We've kind of got to sort through it all. But just to recap, we had nearly 100 folks in attendance, 15 different presentations over 2 days. And we were so fortunate to be able to feature Dr. Denise Johnson that I mentioned earlier, our PA Physician General, Dr. Janice McDaniel, our state dental, public health state dental director, and Rear Admiral Timothy Ricks, who's the highest ranking dental officer in the U.S. Public Health Service. So we'll have a full report on that coming in probably later this month. That'll include high-level notes, some videos from the presentations, lots of photos, and then some of the interventions, because obviously when we hold these events, we gather ideas from the people in attendance. So we're going to start making some plans based on what you've told us. And you can see, I have to point out, we had a graphic illustrator at the summit. And so that banner along the bottom is actually the work that she completed for us. So we'll have some of that up on our website as well, so you guys can dive into that a little closer. She does a really great job just capturing what was said in the room. So then one other thing that we did at our summit that I was just super excited about was that we were able to, for the first time, set up an award structure and honor some of our oral health champions across the state. So we had about 11 or 12, maybe more nominations across the 3 awards. So a lot of very deserving candidates. But we were just delighted to offer, Dr. Eve Kimball was the winner for our individual oral health champion award. Volunteers in Madison in Wilkes-Barre was our organization award recipient for oral health champion. And then Dr. Thomas Regan received our community water fluoridation award for being just a fluoride champion to the max. So really, really just happy to see these folks get some well-deserved recognition. And we really look forward to being able to do this on a recurring basis, because I think we have a ton of people in Pennsylvania who really need recognized. So stay tuned. So I probably went pretty quickly through a lot of that, but I want to spend just 1 minute talking a little bit about some of the work we have planned for next year, because it wouldn't be a very good annual wrap up if we didn't talk about where we're going. So I know we've mentioned some of the work plans we have already in place for 2022, but this is just a few more of the things we're going to be working on over the next 13 months. We would like to publish a formal strategic plan for our organization, which, we haven't done in a formal structure in the past. We've been really doing a deeper dive into the Medicaid disparities in our state. So looking at, even on a county level, who's available to see certain populations. And we'd like to put out, you know, a nice white paper on some of that so we can capture a lot of different data sets in one cohesive document. We'll of course continue the promotion of our state CDC projects around fluoridation, our school sealant programs, and the data surveillance. And then many of you are aware that we had a bill passed in the spring called Boosting Oral Health in Rural Communities, which is directing our Pennsylvania Legislative Budget and Finance Committee to do a study on that. And so we're going to be hopefully being able to help them, assist them, and provide them some data that we have and that we've collected. Of course, we'll work with our State Department of Health in drafting and hopefully implementing another 4-year HRSA grant for PA. Those are due just in the beginning of 2022. And we'll continue to do our trainings around tobacco, fluoride, disabilities, HPV, workforce, everything else that we can possibly think of to help bring that information to all of you. We're also starting to do a little more work in our pipeline programming for building the dental workforce and to do a little bit of a deeper dive into the dental school analysis. So not just for our dental schools in Pennsylvania, but also even looking at schools outside of Pennsylvania like WVU, who do feed dentists into our state. So really making sure that we're looking at where we can make improvements there as well. And then lastly, again, this is just a quick list that we came up with of things we know we're going to be working on next year, is that we've been working with the Pennsylvania Cancer Coalition pretty closely and the Massachusetts HPV Coalition, who works with Team Maureen. And we're going to be working on taking their dental provider HPV toolkit and adapting it for Pennsylvania. So we've already started that work and we will get it published hopefully in early 2022. So those are just a few of the projects that we know we're gonna be working on next year. So if you see a place where you wanna help or you wanna get involved, definitely talk to us. And then if you wanna come and see us in person, here's a list of our events that are already planned for 2022. Our smaller stakeholder meetings are held regionally around the state. So just off the top of my head, we're probably looking at the Scranton area. Westchester, I know, is already booked for that May 20th one, probably up towards Erie, and then somewhere Westmoreland County, Greensburg way for the Southwest meeting. So definitely put those dates on your calendar for whichever one might fit the best for you, so that we make sure that we can talk to you and you can come and join us at our coalition meetings. And then we'll have our 2 virtual updates as well. So those are on the calendar and ready. So make sure you put them there. We also have a calendar on our website that posts all of these events. So if you ever want to look and say, wait, when was that meeting? Just check out our website. There is a calendar page and everything is always posted there, which we're happy to share your events as well. So if you're having a local oral health meeting and you want us to put it on our calendar, we're happy to do that. We love to do that actually. So I'll just wrap up to maintain. I mentioned the calendar there. Usually I would say too, during non-pandemic times, that's a pretty full calendar. It has been a little quiet lately, but things are starting to pick up a little bit. So bookmark that site on your browser so that you can check it out on a regular basis. We also do keep up a pretty strong social media presence. So sometimes, we send a lot of updates in our weekly newsletter, but sometimes we just put things out on social media as well. So if when you get the slides from today, you'll be actually able to click on each of those logos and follow us on social media if you haven't. And then lastly, we do participate as a charity in the Amazon Smile program. So if you're not familiar, you can select a charity that actually gets a donation directly from Amazon. That's a percentage of all your purchases. So you can make PCOH be your charity of choice if you don't already have one selected. So that about wraps up the informative portion of the webinar today. I did give us a few minutes if anyone has any questions. Typically by now, I know there's some typed in, but I'm not seeing any yet. So I'm going to give everybody another minute to make sure that you can type into the Q&A if you have any questions. But I want to thank everybody. I know this time of year is so hectic. And I want to thank everybody, for your time that you spent today learning more about PCOH, what we've been up to. And just thank you so much for your passion in improving oral health, for everyone, for all Pennsylvanians. Every time, we talk to folks, it's just really amazing to see the dedication that some of you have for this work. And let me see here. I think, Amy, you may have to come off of mute and read me the question because I am not seeing it. I think we had one question come in here. Let me see. Oh, there it is. Okay. So, and I know, so we had a question just about different data collection points, and, obviously we've done a lot of different ones, but, there's some things missing. So, right, things like gum inflammation, fluorosis, obstructive sleep apnea, incisor trauma, of course, those are very key points. And I think that, data collection obviously, could go hand in hand to add those points in. And I think, it would be, I would agree with Dr. Greenberg that those data points would be invaluable, especially when we're talking about a thorough oral health status assessment. And yeah, I think we would love to put that in, at this point, and as you can see with some of the points in the data that we collect, we get them from a lot of publicly available sources or sources that have been collected for years. Places like the Behavior Risk Factor Surveillance System, where the state's already talking and doing these surveys every year, so we add some oral health to that. When we start talking about clinical data points, like Dr. Greenberg mentioned, that gets closer, gets a little bit more tricky to collect, but could we do it through already things that are happening with providers? Absolutely. Again, funding is the issue and setting up that structure. So if anyone on the call specifically knows of any great funding sources or even potential funding sources for that type of work, doing some more thorough clinical assessments, I think would be really, really vital to finding out our disease state in the state. So that's a great point. So thank you very much for that. Okay, and I'm not seeing any other questions at this time. So that doesn't mean that we don't want your questions later. So stay tuned. We'll send out the recording and the slides from today. And I will hope to talk to you all in the new year if I don't talk to you any sooner. But again, thanks so much. We're really just so happy to work with you all. So have a great holiday. If you're celebrating, we got lots of reasons to celebrate this year. So we're gonna celebrate at PCOH. So, all right, everybody, have a great day.